Welcome to Module 4 of our Anal Cancer Patient Education Series, The Early Side Effects of Radiation. My name is Emma Holliday, and I'm a GI radiation oncologist here at MD Anderson. Radiation treatment for anal cancer can cause early side effects. These are also sometimes called acute side effects and occur during and immediately after radiation treatments. Early side effects of radiation usually start around the second week of treatment and increase gradually in severity as the treatment goes on. The peak of early side effects is actually 1 to 2 weeks after the final day of radiation. Fatigue is the most common early side effect, and most patients experience this at least to some degree. Most patients tell us they either go to bed earlier at night, take a nap in the middle of the day, or sometimes both. We'll discuss next some of the other possible early side effects of radiation. Radiation can cause a skin reaction called dermatitis that is similar to a burn. With anal cancer radiation, this skin burn can develop around the anus, between the buttocks, or in the groin creases. During the first 2 weeks of radiation, the skin can become dry, itchy, scaly, and red in color. During the 3rd and 4th weeks of radiation, the skin can become more red or dark and may blister or peel. During the final 2 weeks of radiation, the skin may peel more or even form ulcers. There may be some light bleeding from the irritated skin. This can be painful, especially when passing bowel movements or urinating. In addition to the skin burn, patients will sometimes lose their pubic hair during treatment. Radiation can also cause early side effects in the bowel and in the bladder. Radiation can cause an internal sunburn-like reaction called mucositis. Mucositis can cause a constant dull pain in the rectum and anal area. It can also cause very sharp pain when passing bowel movements through this inflamed area. There can also be mucus discharge and bleeding from the anus during treatment. Radiation can also cause irritation of the bowels themselves, called proctitis, colitis, or enteritis. Patients can experience rectal or bowel spasms that feel like cramps or gas pains. Patients can experience frequent bowel movements or diarrhea. Bowel movements can often be more urgent, which means you may not have as much notice from the time you feel like you have to go to when the bowel movement is actually happening. Some patients will even lose control of their bowels at some times. Finally, radiation can cause inflammation of the bladder, which can cause burning with urination, bladder spasms, or having to urinate more frequently. There can rarely be some blood in the urine, but this is less common. Radiation can also have early side effects on the genitals. Women can notice vaginal discharge, pain, irritation, and bleeding due to inflammation of the vagina from radiation. The medical term for this is vaginitis. Vaginal sexual intercourse may be more difficult or painful during and immediately after radiation. Women who have not yet gone through menopause may experience a heavy period, a lighter period, or no period at all during radiation. Men may notice symptoms related to swelling of the prostate gland during radiation. The medical term for this is prostatitis. Symptoms include pelvic pain, a weaker urine stream, having to urinate more frequently, or getting up at night to urinate. Sexual intercourse may be more difficult or painful during radiation, and some men experience painful ejaculation due to swelling of the prostate and seminal vesicles. Radiation to the pelvis has some effect on the bone marrow in the pelvic bones. This can cause the white blood cells, red blood cells, and platelet counts to decrease. This is a less common side effect, but we track blood counts every week because chemotherapy can also have an impact on blood counts. Every patient's side effect profile is different. Your radiation oncologist will discuss with you at your weekly C visits your particular side effects and will recommend over-the-counter and/or prescription medications as needed. Here are some things they may recommend that can help. For managing skin side effects, we recommend starting with the petroleum jelly-based ointment such as Aquaphor when the skin side effects are mild. When the skin starts to blister or peel, a lanolin-based barrier cream can also help soothe open or blistered areas and protect the skin, particularly if you are also having diarrhea. Towards the end of radiation, your radiation oncologist may prescribe a prescription cream called silver sulfadiazine. This prescription cream has antibiotic properties and will reduce the risk of infection, as well as promoting skin healing. It's important not to put this cream inside the vagina or anus. It's for use on the external skin only. For areas of painful skin or for inflamed hemorrhoids, a topical lidocaine cream or ointment can be prescribed to numb the area. It's best not to have a thick layer of cream or ointment on your skin when you arrive for your radiation treatment appointment each day. Radiation to this very sensitive part of the body is uncomfortable, particularly during the last 2 weeks of treatment. And the first 2 weeks after treatment has been completed can be the worst of all. These creams can help with skin discomfort, but many patients will also need to take prescription pain medication during treatment. Your radiation oncologist will assess your pain level at each weekly visit and may also involve a pain management specialist doctor to help if necessary. Here are some other skincare tips that can help your time on treatment be a little more comfortable. Swapping toilet paper for alcohol-free flushable wet wipes can help protect the sensitive skin around the anus. Using a bidet or perineal squirt bottle can also be helpful. Perineal squirt bottles can be purchased in the postpartum products area of the drugstore or online. You fill the bottle with either cool or lukewarm water and squirt the water at the perineum and anus during and/or after urinating or having a bowel movement. A sitz bath can also be very soothing to irritated skin. You can buy a sitz bath at the drugstore and fill it with plain lukewarm water. You can also add Epsom salts, or your doctor may recommend Dumboro soaks. Many patients find it helpful to soak their perineal area in a sitz bath after every bowel movement to soothe the skin and to keep the skin clean. Wearing loose or airy clothing promotes comfort. Some patients say that disposable mesh underwear, also found in the postpartum products area of the drugstore or online, are convenient and comfortable. Perineal cool packs can be placed in your underwear to soothe the area. These are sold in both disposable as well as washable versions. With regard to bowel side effects, you do not need to make any preventative changes to your diet, but if you start to experience diarrhea, make note about what foods are harder on your digestion. Most patients tell us they need to follow a low-fiber, bland diet if they develop diarrhea. Spicy foods and greasy foods can also be harder on digestion. You will meet with a dietitian at least weekly during radiation treatment to help get personalized recommendations on dietary plans to follow. In addition to dietary changes, medications are often needed to manage the early bowel side effects of radiation, particularly diarrhea. Most patients will need to use loperamide, also called Imodium, as the first-line treatment for diarrhea. Loperamide is available over the counter. You can take 1 to 2 2-milligram tablets after the first loose stool, then 1 tablet every 2 hours until you are diarrhea-free for 12 hours. You should not exceed more than 8 tablets per day. Diphenoxylate atropine, also called Lomotil, is the second-line treatment for diarrhea and can be prescribed by your radiation oncologist or medical oncologist. You can take 1 to 2 tablets by mouth every 6 hours. Again, you should not exceed more than 8 tablets per day. You can alternate Imodium and Lomotil as needed if your diarrhea becomes severe. Let your doctor know if you are taking the maximum amount of these 2 medications and your diarrhea is not well controlled. It may mean you need something stronger. If you develop cramping during radiation, a prescription medicine called dicycloverine or Bentyl can help. Although most patients experience diarrhea during radiation, some patients will develop constipation. This can happen because constipation is a common side effect of many nausea and pain prescription medications. Sometimes taking too many anti-diarrhea pills can cause constipation. Passing stools that are too large or too firm can cause more pain to the anal canal and rectum, so it's helpful to keep your stool soft. A stool softener called docusate sodium or Colace, or an osmotic laxative like polyethylene glycol or Miralax can help. It's best to avoid stimulant laxatives like Senna because it can cause cramping and worsen any cramping that's caused by radiation. Please alert your radiation team if you have not had a bowel movement in more than 5 days. Staying well hydrated by drinking plenty of water is a great way to avoid or help treat urinary side effects from radiation. Let your doctor know if you have any pain with urination or other urinary changes. Your doctor will likely order a urine sample to check to see if you have a urinary tract infection and will prescribe antibiotics if you have one. If you experience burning with urination that's not caused by a UTI, a medication called Pyridium can help. Pyridium is available over the counter under the brand name Azo. One side effect of Pyridium is that it can cause your urine to turn orange. This is a normal side effect of the radiation, and although it can be surprising, it's not harmful. For men, let your doctor know if you notice any signs of prostate swelling, like a weak urinary stream, urinating more frequently, or the sensation that you cannot fully empty your bladder. If this occurs, a prescription medication called tamsulosin can be given to help the urine flow more easily until the radiation inflammation goes away. Towards the end of radiation, we like to remind patients that the worst of the radiation side effects can be somewhat delayed and actually can occur 1 to 2 weeks after the final day of radiation treatment. Usually there are no new side effects that start after radiation has been completed, but any side effects that are present during the last week of treatment will usually get a little worse before they get better. At your last weekly visit with your radiation oncologist, they will make sure you have enough medications to get you through the post-treatment peak in your side effects. Side effects usually start to slowly improve about 2 weeks after the radiation has been completed. It can take 6 weeks or more for the early side effects to go away. Good habits, such as focusing on nutrition, regular, gentle physical activity, and resting when your body feels tired, will help you recover. Bowel function and anal sphincter control can take longer to recover. Some patients never fully regain their pre-treatment function. You will hear a little bit more about this in Module 5. Thank you for your attention. Although not all patients will experience all the side effects covered in this presentation, it's good to be prepared. Remember, your radiation oncology team will work hard to help you manage any side effects that you develop during treatment. Thank you.